and noting that maternal and neonatal tetanus disease, as well as wild poliovirus, have been eradicated in Kenya. And this is through continuous investment in immunization services. Now, a scaling of these joint investments has seen a further expansion of our immunization programs through the introduction of 6 new vaccines in the past decade, all of which continue to contribute to the reduction of childhood diseases and deaths. These vaccines, amongst them, the vaccine against cervical cancer, amongst them, rotavirus, amongst them, pneumococcal vaccine, are all available free of charge through a network of 9,500 health facilities across the country, teaming with facilities from the public, private sector, faith-based facilities, as well as NGO organizations. The Ministry of Health continues to sustain its investments in immunization services, and we take note that at least in the year 2019, we were able to attain a national average of 83%. However, in the age of COVID-19, we do note a decline in the absolute number of children who are vaccinated, and this has been observed, of course, due to disruption brought about by coronavirus. And when we compare the same time period this year compared to last year, we are noting that we have a 2.34% dip. Last year, we had about 640,000 children immunized as at this time. This year, we've shaved off about 20,000, coming to around 600,025 children vaccinated this year. In addition, we've also noticed a dip when it comes to the HPV vaccine for 10-year-old girls, which currently stands at a coverage rate of 46%. And so in the age of COVID-19, we continue to remind all Kenyans and to inform them that immunization services are ongoing and are available across all our healthcare facilities, and that the vaccine schedules, as delivered through the National Immunization Program, are there and are available. We continue to encourage parents and guardians to ensure that their 10-year-old girls have received at least the 2 doses of the HPV vaccine, and for our infants that we ensure that they complete their vaccination schedule, particularly targeting to ensure that all infants have received 2 doses of the measles rubella vaccine by the time they're 2 years old. Now, turning to the issue of COVID-19 and vaccines and immunization, Kenya continues to engage in different negotiations and discussions, most noting our permanent mission in Geneva that is contributing to these discussions and is in consultation with a global umbrella facility body known as COVAX. This is a body that is coming together under the stewardship of WHO and Gavi to ensure that vaccines are availed at a cost that is affordable to countries, and most particularly to ensure that there's equitable distribution when it comes to vaccines. Yesterday, we promised you that we shall continue to share with you information when it comes to the epidemiology of this disease. We've been getting continuous questions as to where we are in the curve, and we shall continue to share with you that information. Today, we would like to focus on a key area when it comes to defining the epidemiological curve of a disease, and that is the caseload and the positivity rate. And so today's brief will focus on that, and as we continue our daily briefings, we'll be able to share more epidemiological data. In that regard, as at yesterday, we had a caseload of about 30,000 confirmed cases. And what is important to understand is that from this caseload, out of our sample sizes, the current positivity rate in the country stands at 7.9%. And over the last 34 weeks, this positivity rate has steadily increased from an initial 2%, if you remember, at the beginning of the epidemic, to the current 7.9%. And this increase points to an acceleration in the rate of transmission of the disease. And this perhaps is the first answer to the question that we had yesterday as to where are we on the curve? Are we flattening the curve? Despite recording new lower numbers, where are we? And if we were to look and extrapolate this 7.9% positivity rate, it would mean right now in the country assuming a population of about 47 million, it would mean that we have about 3 million cases. Again, if we look at the change in positivity rate from the beginning of this pandemic to where we are today, it points out that the curve is not flattening. And this will be shared with you in terms of the graphs and figures that we've shared with you to show you that the curve is still peaking. Now, as we, try and understand what does it mean then for Kenya to have a positivity rate of 7.9%, we've been able to look at different global benchmarks across the world, benchmarks that point to, what is the acceptable positivity rate, at what point will a positivity rate tell us that we are actually, able to stamp down this curve? And global benchmarks by WHO tell us that when a country records a positivity rate of at least 5% or lower over a period of 14 days, then indeed we are getting to the point where we are able to flatten this curve. And as you can see, today we stand at 7.9%. And so we are continuing to ensure that we manage this pandemic and get to that global benchmark of 5% for 14 days. Now, turning on to our COVID-19 statistics today, 426 people have tested positive out of a sample of 5,158 samples collected within the last 24 hours. And this now brings the country caseload to 31,441 number of positive cases. And from all these cases, all are Kenyan, except 9 of them. In terms of disaggregation, we have 239 males, 187 females, with the youngest being a 3-month-old infant, and the oldest is 88 years. In terms of distribution by county, Nairobi leads with 132 cases. Kajiado has 63, Kericho 48, Kiambu 24, Machakos 21, Migori 17, Mombasa 16, Kitui 13, Laikipia 13. Both Nakuru and Kisumu have 11 cases. Uasin Gishu has 10, Tharaka Nithi 8, Nyeri, Busia 7, Makueni 6, Kilifi 4, Garissa 3, Nyandarua 3, Isiolo and Embu both have 2 cases, whereas Meru, Kirinyaga, Kakamega, Baringo and Lamu all have 1 case. We continue to provide you with a disaggregation by sub-county, and that will be shared with you, where you can see which sub-counties have the highest number of cases per county. With regard to recovery, we have 257 patients that have recovered from the disease, with 195 from the home-based care program, whereas 62 have been discharged from various hospitals. And therefore, our total number of recoveries stands at 17,869. And we continue to thank all the frontline healthcare workers for the good job that they're doing. On a sad note, today we've lost 10 patients to the disease, bringing our fatality to 516. And of note today is that 3 of these deaths are actually community deaths. And I think the DG will speak to the importance of ensuring that you actually seek care, promptly. And again, interesting to note is that these 3 deaths are actually, I think, below 30 years old. So it means that there's a problem there when it comes to seeking health care amongst the young population. We do extend our sincere condolences to families and friends of those who've lost their loved ones. Thank you.
My name is Dorcas Wangera from Citizen TV. Healthcare workers continue to raise several grievances. Like today we had different cadres talking about having lack of PPEs, not getting their allowances from the ministry, also issues of healthcare workers who have underlying conditions and some who are expectant, wanting to be exempted from work. What will be the ministry's intervention? Even Nairobi's healthcare workers had threatened to down their tools, and you've mentioned healthcare workers are doing a good job, but they say that their grievances are not being heard. And then secondly, about the positivity rate, you talk about 7.9%. So in terms of what will it take to get to this 5%? Because you're already seeing there being restrictions with travel. Will there be stiffer measures?